A very warm welcome to our third Global Health Cast COVID special, a co-production between Global Health Press and the Coalition for Life Course Immunization, CLCI. This podcast was made possible through an unrestricted grant from Novavax. Our 6 specials will cover epidemiology and surveillance, long COVID, COVID in children, vaccines and vaccination. And today, I'm very happy that we have a special with Professor Bruno Lina, who is an expert in the virology area. So I'm very happy to have him here. I am Joe Schmitt, and with me throughout the 6 COVID podcasts is Professor Catherine Weil-Olivier. Hello, Catherine.
Hello, both of you.
Our topic today, again, on COVID is virology and the future of this SARS-CoV-2 virus. And again, it is our great pleasure and honor today to have for this topic Professor Bruno Lina with us. Hello, Professor Lina.
Hello.
Professor Bruno Lina graduated in medicine and holds a PhD. He is a professor in virology at the University of Lyon, where he heads the virology laboratory. In addition, Professor Lina is director of the National Influenza Center, director of the French National Reference Center for Enteroviruses, and he heads a research team. He is a scientific consultant for the French Ministry of Health, and he has been repeatedly served as expert for WHO and CDC, as well as various other national and international organizations. Currently, he chairs the scientific committees of the Global Influenza and RSV initiatives, the Global Influenza Hospital Surveillance Network, and the Immuniser Lyon programs. He has published more than 450 peer-reviewed articles, several book chapters and books on influenza and other respiratory viruses. A very warm welcome, Professor Lina.
Thank you. Thank you very much. Very happy to be with you today.
And let's start with the first question right away. The question is, what is the current situation with the SARS-CoV-2 coronavirus worldwide? What are the variants? What are the case numbers? Where are we today?
Well, it's difficult to answer properly to that question in terms of detail as it was before, because the indicators we used to have during the pandemic are now not as available as they were before. But still, what we know is based on the surveillance, there's some major viruses that are circulating, whose name is EG5 and EG5.1. These are the main viruses that are circulating. They are descendant of the XBB1.5 virus, and these are responsible for the beginning of the starting of the increase of the cases we see now in Europe, and that's been seen also in the US and other parts of the world. So that's the dominant strain right now. But there's something particular that we are looking after is the emergence of a new virus, which is called the BA2.68. There's a nickname that is used in the public, which is Pirola. And this virus actually is having a lot of mutations. It's harboring more than 30 mutations on the spike protein, which makes this virus an escape mutant, a potent escape mutant against the immunity that we have since the circulation of the COVID. And this virus is supposed to be emerging from in an immunocompromised patient, where actually he acquired during the chronic infection these multiple mutations, and he has now spread all over the world. The good news, however, is that the transmissibility of this virus is really very low as compared to the EG5 virus. So in the context of competition between viruses, we don't know whether this virus is going to take over and be responsible for an epidemic, or if the EG5 is so strong that he will not take over and he will not be responsible for anything. So it will end up by disappearing. That is something that we're going to look after in the coming weeks, but nobody knows, nobody has the answer so far.
Mm-hmm.
Excellent. So this BA286 is seen globally, but cases are quite rare at the moment, and they seem not to be very severe. We see no real difference between the severity of cases and what happened before, and partly probably because the population has a high level of immunity, natural immunity, or achieved post-vaccines. Could you say a word about wastewaters and the interest of the surveillance? And second, emphasize the importance of genomic surveillance.
Yeah, that's a very good point, because actually the wastewater surveillance turns out to be quite sensitive to detect new emerging variants. But it's better when you know what you're looking for when you're looking at wastewater, and just looking at broad sequences, because it's very difficult to have robust sequence data from the wastewater surveillance system. But still, based on this Pirola detection, the BA2.68, actually some countries have been detecting these viruses in wastewater, like Norway or Germany, whereas they didn't pick up cases with that. But what is important in terms of sequencing for the viruses that we have from the cases is that it's the better way to have a rapid way of monitoring the evolution of the viruses. So should you want to look at the different viruses that are circulating, it's through the sequencing that you would be the most accurate in terms of surveillance. And that's also the basis of the classification and the denomination of the viruses that we use. It's not based on immune escapes like we can do for influenza viruses, for example. It's really based on sequence data. So we share that very rapidly through different platforms, and the most known platform is the GIZ platform, where actually everybody is putting on real time the new sequence data they have. So that's a very good way of having a system to monitor the circulation of the viruses worldwide. So sequencing is really mandatory, and everybody is doing that now.
So I think you are targeting a very important point. That is, we are following very carefully all the genomic mutations, and it's nearly the day after we can confirm that we have a new virus. In terms of BA286, it seems to have a jump in the number of mutation and the location of mutation. So does this imply any new concern?
Well, yes, because actually these changes we see in the spike protein especially are really driving immune escape. So it means that the pre-existing humoral immunity that everybody has because of infection, because of immunization through vaccines, may not be enough to prevent from an infection. Like you said earlier on, the cellular immunity that we all acquire through vaccination or infection remains efficient. So there will not be severe cases, except for those that are fragile for this infection, and we are talking about immunocompromised patients, and we are talking about elderly patients, pregnant women, obese, and those that have chronic conditions, making them fragile against this infection in general. But this BA2.68 remains an Omicron strain, and it has the features of the Omicron virus.
Thank you.
That is very interesting. So this is all about the virological background. Now, I guess what the audience is really interested in to look into the future. And the future, as you are not only an expert for coronaviruses, but also for influenza and RSV, I dare to ask the question, what will the respiratory season 2023-2024 look like with regard to corona, RSV, and influenza? You don't have to answer them, but I guess that is, what would be a scientific assessment, how to approach the problem, or what are scenarios that you're working with?
Yeah, we have to work on scenarios. We have to anticipate what could be the future. Actually, what we think we are going to see in the near future, the coming weeks, is a rise in the cases of SARS-CoV-2, because it has started already in Europe, it has started in the US, so that's for the northern hemisphere, and we also see an increase in the cases in Southern Korea. So we see that in all this region, there's an increase in the number of cases. The increase is driven by the EG5 strain, which is really very fit. And the figure we have as of today, as in our effective, the reproductive number we have right now for the EG5 is 1.3. So it means that we're on the edge of a beginning of a circulation of that virus. How long will that last? We don't know. But, you know, the schools are opening right now in Europe, and that could be a driver for an increase of the number of cases. But we don't only see cases of SARS-CoV-2. We see other viruses circulating, like rhinoviruses. And we tend to see some of influenza cases, which is just normal. We don't see much RSV. But what we expect, what would be if these viruses behave normally, which is never the case. We should see an increase of the cases of SARS-CoV-2 now during October. And then it should be displaced by the RSV. And the RSV, if it behaves properly, should start a circulation by the end of October and the beginning of November. It should peak by December in Europe. And then we should see the influenza viruses circulating. That would be, you know, what should happen if they behave properly. But we know that they don't behave properly, never. And the thing is that these viruses may be co-circulating, and we've seen that last winter when these viruses were circulating at the same time and they were peaking at the same time, which is, you know, a nightmare in terms of disease management for hospital and medics in general. So what we can see from the southern hemisphere is that it seems that the regularity of the viruses seems to go back to what it was before the COVID crisis. And then so we may expect that if everything behaves, if they behave properly, we should see these viruses being responsible for the epidemic, the one after the other. So that's what we expect. But again, going back to the Pirola virus, if this virus is going to take over, and if for some reasons is going to displace EG5, then we should expect to have an early circulation of a second wave of the coronavirus during this winter. So there's a lot of uncertainties. We know that the RSV is going to circulating. We know that the flu is going to circulate. We know also that there's some measures that could be taken to reduce the impact of these viruses through vaccination or through immunization against RSV and influenza. And we know see that people are able to wear masks and to have, you know, a global behavior that would prevent the transmission of these viruses. So all these has to be taken account. And so when you pile up all these possibilities, you end up by saying that we don't know what is going to happen in the future.
Bruno, you are summarizing extremely well the gap or the discrepancies existing between very good science. We have diagnostic, we have the capacity to follow, and it's very difficult for the public to understand that though we have this quality, it's very difficult to anticipate. So viruses are going their own way. We don't know all of them, and we don't know all, and we have surprises, and we have to be aware that we have to adapt to those surprises.
I agree. We have to be modest because we're always caught by surprise.
Yeah.
So, Professor Lina, next year, 6 months from now, we will reconvene and we analyze what we said today, right?
Be happy
Catherine.
to do it.
The next point is the perspective of vaccines. And could you say a word about the new vaccine expected for the fall and why it is useful to consider being vaccinated again?
Well, the point is that, you know, when you look at the immune response in respiratory infections and in viral infection in respiratory disease, we know that the protection is not lasting very long. There's a wane of the humoral immunity, whatever the virus. So, and this is true when you are infected as well as when you are vaccinated. And the fragile people are remaining fragile over the world, over the year. And so that's the reason why there's a need for new vaccines, again, to keep updating the immune response so that it matches with the circulation of the virus. We know that for influenza, but that's true for SARS-CoV-2 as well. And the good news is that in the near future, in the coming weeks in Europe, there will be a vaccine that would be available, which is based on XBB 1.5. And this vaccine is highly protecting against the EG5 strain. It's really the same antigenic sites that we have with these viruses. So these vaccines are going to be available by the end of September. So it matches more or less with the risk of the circulation of the virus. So we urge the fragile people, the people that are more than 65, the pregnant women, the obese, those with chronic conditions, to get this immunization with this vaccine, because they will be protected against the severe cases through this vaccination. And we know so that it reduces transmission and it reduces the global circulation of the virus. However, when you're in the context of an epidemic, you need to use the other measures to control the dissemination of the virus. And those are very clear. Since we are in late summer, beginning of autumn, you can open the windows because it's really renewing the air, the inside air, which is very important to try to reduce the density of the virus in closed areas. You have to wear a mask when you're sick. You have to be able to say what is the virus that is responsible for your presentation when you're sick. So self-test yourself and look at what is the virus. And also you have to wash your hands with all the soaps and the system that could prevent transmission as much as possible.
And last but not least, could you say again that it is possible to receive the same day influenza vaccines and COVID vaccines?
Absolutely. That has been demonstrated during the last year season of vaccination, where really we could see that those that received the 2 shots at the same time did not present any worsening of the side effect as compared to those that received it the one after the other. So, you have to remember that at the beginning of the vaccination that with SARS-CoV-2, we were cautious because we want to check about the side effects of these vaccines, because that was very important to collect this information. Now that we know that these vaccines are safe, that they could be co-administrated with the flu shot with no problem, you have to save time, and you can do both at the same time. And you know that the protection that we get against these 2 viruses is equivalent as if you do it at the same time or one week apart. So save time and be protected at the same time against the 2 viruses.
Joe, you conclude?
Yeah, absolutely. And I just wonder one thing. There is now an RSV, or actually 2 RSV vaccines out there, and there's a long-acting monoclonal antibody, right? So how about injecting all 3 at the same time?
Well, I would not suggest to do so again, because we need to collect the information regarding the side effects of the RSV vaccines. So these vaccines, if they are going to be used against individuals for elderly and maybe for pregnant women, but I don't know if it's already ready for pregnant women. I think it's going to be next year. But again, in this case, I would do these shots separately, and I would not do it again. Regarding the immunization, that's mainly for the very young kids and the newborns. So we cannot inject the vaccines in these newborns. So the question is not there. Yeah.
Very good, Professor Lina. This was really comprehensive and concise. We covered the circulating viruses, the Pirola strain, and the new vaccine strain that is available later this month. You forecasted the sequence of events with regard to respiratory viruses this year. Very courageous. And we will follow up on that. I'm thinking next year. I'm really looking forward to this. You covered who should get the vaccine, and I guess very importantly, we should remember to wash hands, open windows, wear masks whenever appropriate. So I have no further questions, but Catherine...
No, you summarized quite well. Thank you so much.
So this was our Global Healthcast COVID special with Professor Bruno Lina. Today is September 5th, 2023. Please like, share, and leave your comments below. Thanks for joining us today. I am Joe Schmitt.
I'm Bruno Lina.
I am Catherine Weil-Olivier.